So radium-223, or Xofigo, is a first-in-class injectable radiopharmaceutical for prostate cancer. How does this therapy specifically target bone lesions in advanced cancer patients? Well, the active moiety of Xofigo is the alpha particle emitting isotope radium-223, radium-223 dichloride, which mimics calcium and forms complexes with bone at areas of increased bone turnover, such as metastasis. The high linear energy transfer of alpha emitters, which is 80 kiloelectron volts per micrometer, leads to a high frequency of double-stranded DNA breaks in adjacent tissues, results in an anti-tumor effect on bone metastasis. The alpha particle range from Xofigo is less than 100 micrometers, which for the layman is less than 10 cell diameters. This limits damage to the normal surrounding tissue. The phase III ALSYMPCA trial results were presented at the annual ASCO meeting in 2012, and further sub-analysis of the results were presented at the ASCO Genitourinary Cancer Symposium in February of 2013. So what were the efficacy results of the trial? The efficacy and safety of Xofigo were evaluated in a double-blind, randomized, placebo-controlled phase III clinical trial of patients with castrate-resistant prostate cancer with symptomatic bone metastasis. Patients with visceral metastasis and malignant lymphadenopathy exceeding 3 centimeters were excluded. The primary efficacy endpoint was overall survival. A key secondary efficacy endpoint was time to first symptomatic skeletal event, or SSE, as defined by external beam radiation therapy to relieve skeletal symptoms, new symptomatic pathologic bone fracture, the occurrence of spinal cord compression, or tumor-related orthopedic surgical intervention. There were no scheduled radiographic assessments performed on study. All patients were to continue androgen deprivation therapy. At the cutoff date of the pre-planned interim analysis, a total of 809 patients had been randomized 2-to-1 to receive Xofigo, 50 kilobecquerels, IV every 4 weeks for 6 cycles, with an N of 541 patients, plus best standard of care or matching placebo plus best standard of care in 268 patients. Now, the best standard of care included local external beam radiation therapy, corticosteroids, anti-estrogens, estrogens, or ketoconazole. Therapy was continued until unacceptable toxicity or initiation of cytotoxic chemotherapy, other systemic radioisotopes, hemi-body external beam radiation therapy, or other investigational drug. Patients with Crohn's disease, ulcerative colitis, prior hemi-body radiation, or untreated intermittent spinal cord compression were excluded from the ALSYMPCA trial. In patients with bone fractures, orthopedic stabilization was performed before starting or resuming treatment with Xofigo. The following patient demographics and baseline disease characteristics were balanced between the arms. The median age was 71, with a range between 44 and 94, with a racial distribution of 94% Caucasian, 4% Asian, 2% Black, and less than 1% other. Patients were enrolled predominantly from Europe, 85%, with 4% of patients enrolled from North America. The ECOG performance status was 0-1 in over 86% of patients. 85% of patients had 6 or more bone scan lesions and of those, 40% had greater than 20 lesions or a superscan. Opiate pain medications were used for cancer-related pain in 54% of patients. But interestingly, non-opioid pain medications were used in 44% of patients, and no pain medication was used in 2% of patients. Patients were stratified by baseline ALP, biphosphonate use, and prior docetaxel exposure. Prior bisphosphonates were used in about 41% of patients, and 58% had received prior docetaxel. During the treatment period, 83% of Xofigo patients and 82% of placebo patients received gonadotropin-releasing hormone agents, and 21% of Xofigo patients and 34% of placebo patients received concomitant anti-androgens. The use of systemic steroids was in 41% of patients and biphosphonates in 40% of patients. And this was well balanced between the arms. The pre-specified interim analysis of overall survival revealed a statistical significance improvement in patients receiving Xofigo plus best standard of care compared with patients receiving placebo plus best standard of care. An exploratory updated overall survival analysis performed before patient crossover with an additional 214 events resulted in findings consistent with the interim analysis.